Today I am going to talk about SLR, otherwise called as straight leg raising test. This is one of the commonest tests that I do for all my lower back pain patients. This test is a very good tool to know the extent of the pathology that one has in the lumbar spine. So this SLR is always a passive test. Don't ask the patient to lift the leg. It's always a passive test. One hand under the distal aspect of the thigh and one hand under the distal aspect of the leg. And avoid bending the knee and doing the SLR. You have to always keep the knee straight as you lift the entire leg, and do it as easy and as passively as possible without any patient's effort. And as you lift the leg, the patient should tell whether he is having any pain anywhere in the lower back or thighs or anywhere, because everybody thinks that when you do SLR the pain must be felt in the lower back. It is not. There are so many instances the pain will be felt in the front of the thigh. I have seen some patients of mine, the pain was felt in the shin of the tibia. Sometimes the pain would be felt in the calf or even in the hamstrings. So the pain locality doesn't matter here. When you do an SLR, the pain can be variable, even though most commonly in the lower back or in the buttock region. Be aware that it can exhibit in other areas as well, including the groin area. Alright, and make sure that when you do the SLR, the patient is discriminating whether it's a hamstring tightness or it's really a pain due to the irritated nerve. That you can confirm by doing the SLR in the other side, and check for the similarity of the range and the similarity of the feeling. Means some SLRs, when they are positive, they give the pain in the hamstring. It's not a hamstring tightness but a sciatica nerve irritation. You do the same test with the other leg and check for the quality of the feel. If the quality of the feel or the quality of the sensation is similar on both the legs, then you can confirm that as a hamstring problem. If the quality is different here, even though the range may be equal on both the sides, for example, it can be 60 degree here, it can be 60 degree here, but the quality, if it differs, then it can be confirmed it as a sciatica pain, not the hamstring tightness. And there are some people who are very flexible, like yoga ladies, some people who are having congenital ligamental laxity, they will be having extreme good ranges in the SLR. In such cases, it's very difficult to pick up a sciatica, even though the disc is bulging and nerve is compressed. SLR will be negative because they are fundamentally very loose. In such cases, you can add one more test called as Bragard's test, where you do a full flexion of the hip joint and then you do an dorsiflexion of the ankle. If dorsiflexion produces the pain in the lower back, then it can be additionally confirmed that it could be a sciatic. But do understand that SLR is not a gold standard test. Though it is having very good sensitivity, it is not very good in specificity. That means this test is good in ruling out a sciatica, but it is not so good in ruling in a sciatica. So that's the reason why when the test is negative, you can fairly confirm that there is no nerve irritation or a disc bulge. But when the test is positive, it could be due to other reasons as well. There is one more test called as crossed SLR, where the problem will be on the other side. And when you do the SLR on the opposite side, for example, in this client, if he is having pain on the left side, when I do the right side straight leg raise test, the pain will be felt in the opposite side. So this is called as crossed SLR test positive. More than SLR, crossed SLR test is so good in terms of specificity. That means when the test is positive in producing the pain in the opposite side, then you can confirm that with reasonable surety that the patient is having a sciatica on the other side. There are some instances when you do an SLR, the patient may have pain in the jaw, he can have pain in the head, it can cause his familiar headache, or it can cause pain in the neck. I'm sure if you are a seasoned physiotherapist or have been doing this test regularly, you must have encountered such instance. There is a mechanics for that. If you want to know the mechanics of that, type comment in the comment section. I'll tell the answer for that, why people get headache when you do the SLR. When the SLR test is positive, what would be the diagnosis you make? You can make the diagnosis of the sciatic nerve root is getting irritated at the lumbar level. 90% of the time, the reason would be because of the disc bulge or disc herniation or disc protrusion, whatever you call, but it's a disc pathology which is compressing the roots of the sciatic nerve. People think that the entire sciatic nerve is getting compressed in sciatica. It is not. One or the other roots like L4 or L5 or S1, one or the other roots of sciatic nerve will get compressed. When you do this straight leg raise, what you are biomechanically doing is, by this hip flexion, you are creating a posterior pelvic tilt in the lumbar spine. So the combined effect of hip flexion and posterior pelvic tilt will create a lumbar flexion. So you know that when there is a pre-existing posterior disc bulge, when you do a lumbar flexion, the bulge will increase and cause more nerve compression. And that's a mechanism why when you do an SLR, due to the effect of posterior pelvic tilt and hip flexion, there is a resultant lumbar flexion that causes further worsening of the disc bulge, that causes further compression of the nerve. So the patient will feel the familiar symptom, or otherwise called as concordant pain. You understand? So that's the mechanism of why SLR is producing the pain. But at the same time, as I mentioned, there are some mild disc bulges which won't be anyway positive during SLR. So in that case, don't rule them out that they don't have sciatica, because sciatica is like a ghost disease. It can come with various variations. Given that during the SLR you are increasing the disc bulge, which causes more nerve compression, the nerve is producing the pain in the extremity. So the pain locality, as I mentioned, it can be in the hamstring area, it can be in the calf area, it can be anywhere else. But it's an indication that the nerve is crying for help. Whenever the test is positive, this is a provocation test, right? What is provocation test? You are producing the pain by creating a small irritation to the structure. So by doing SLR, you are producing the nerve pain which is already irritated by the bulging disc. Now, when this is an indication that the nerve is irritated by doing this test, you need to not do it again and again, because it's going to only provocate the pain more and more. That's the reason why I'm not a huge fan of your nerve gliding and nerve sliding, because no matter whatever nerve gliding and nerve sliding you do, the fundamental problem is not a primary nerve issue. It's a problem of the disc bulge, which is secondarily compressing the nerve. So no matter whatever nerve sliding and gliding you do, you're not going to change the disc bulge. So though it feels nice when you do the stretching, it's not going to cause a long lasting improvement to the disc bulge. Instead of treating the nerve, you have to treat the disc. This SLR is not the only test I do. We also add SLR with prone knee bend test, sometimes slump test. So these are the other tests we do. Plus we do a lot of clinical examinations, and then we ask them various questions to know that the nature of the problem, what is the duration of the problem, what is the intensity of the problem, so that we can predict how long the patient will take to improve, what are the exercises he has to do. In that way, we will be able to give a comprehensive treatment to the patient. As I mentioned, always every physio must treat the pathophysiology of the problem, not merely the symptom. If you only treat the symptom, you just become a mediocre therapist. You will not be becoming an exceptional therapist. So treat the pathophysiology and use this SLR as one of the tools to diagnose sciatica. As I mentioned, sciatica is a symptom. Sciatica is not a diagnosis. The disc bulge which is causing the nerve compression that causes the sciatica type of pain. Okay, thank you.